Hello everyone. Let's study about DSM-5 today. DSM-5 Classification System of Abnormality. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, is a classification system used by clinicians to diagnose and categorize mental disorders. It provides a standardized framework for identifying and understanding psychological abnormalities and mental health disorders. Published by the American Psychiatric Association (APA), DSM-5 is widely used globally in both clinical practice and research. Key features of the DSM-5 system. 1. Categorical approach. DSM-5 employs a categorical system, where mental disorders are grouped into broad categories based on shared symptoms. Each disorder is clearly defined with specific diagnostic criteria. 2. Diagnostic criteria. Each disorder in DSM-5 has a list of diagnostic criteria, including symptoms, duration, and severity. To diagnose a disorder, individuals must meet a minimum number of criteria. 3. Spectrum-based classification. DSM-5 introduces the idea that many mental disorders exist on a spectrum, recognizing variations in severity, symptom presentation, and functioning. For example, autism spectrum disorder (ASD) includes a range of symptoms from mild to severe. 4. Cultural considerations. DSM-5 acknowledges the importance of cultural context in diagnosing mental disorders. It emphasizes that behaviors considered abnormal in one culture may be normal in another, and cultural factors should be taken into account in clinical evaluation. 5. Dimensional assessments. In addition to categorical classification, DSM-5 allows for dimensional assessments of the severity of symptoms. This includes assessing symptom severity on a scale, such as mild, moderate, or severe, to capture the full picture of an individual's experience. 6. Removal of axial system. Previous editions of the DSM used a 5-axis system for diagnosis, which DSM-5 has removed. Instead, the focus is now on a single comprehensive diagnosis. 7. Changes and updates. DSM-5 introduced new disorders, revised the criteria for existing disorders, and reclassified some conditions. For example, obsessive-compulsive disorder (OCD) was moved out of the anxiety disorders category and given its own section. 8. Comorbidity. DSM-5 recognizes the high rate of comorbidity, where individuals may meet criteria for multiple mental disorders. This allows clinicians to diagnose and treat individuals with complex presentations more accurately. Examples of categories in DSM-5. A neurodevelopmental disorders. Autism spectrum disorder (ASD), ADHD, a schizophrenia spectrum and other psychotic disorders. Schizophrenia. A mood disorders. Major depressive disorder, bipolar disorder. Anxiety disorders. Generalized anxiety disorder, GAD. Panic disorder. Obsessive-compulsive and related disorders. OCD, body dysmorphic disorder. A trauma and stressor-related disorders. Post-traumatic stress disorder, PTSD. Personality disorders. Borderline personality disorder. Antisocial personality disorder. The DSM-5 continues to evolve with ongoing research and updates, providing a crucial tool for mental health professionals to standardize diagnoses and facilitate treatment across diverse populations.